My name is Haley Franklin, and the disease I have is hypertension. Hypertension is a condition where the force of the blood against the artery walls is consistently too high, and it's a major risk factor for heart disease, stroke, and kidney disease. It's typically known as a silent killer, but that's just because people don't really realize they have it until they start to have symptoms. So often it's too late to kind of treat it, or it gets so serious to where you have to do immediate treatment. Hypertension is typically diagnosed when blood pressure readings are consistently 140 over 90 or higher. And the CDC reported that nearly 1 in 3 adults in the US have high blood pressure, which is about 16 million people, and globally that's about 1.13 billion people who suffer from hypertension. The cost that goes with this condition will be our direct costs, which include clinical visits, diagnostics, hospitalization, medication, and ongoing monitoring, will be around 131 billion a year. Our indirect costs was be like leads to decreased productivity, being absent, or premature mortality is around 25 billion annually. And our intangible costs is pain, suffering, and diminished quality of life. That could include physical burdens, psychological burdens, emotional burdens, such as like chronic fatigue, anxiety, and reduced quality of life, making it harder to quantify, but deeply it affects patients and families real bad, really bad. Why does hypertension matter? Because it's a major contributor to cardiovascular disease and strokes, which are amongst the leading causes of death globally. It's often asymptomatic, so you're unaware that you have it until you experience a health crisis. And many individuals with hypertension remain undiagnosed until complications arise, making early interventions and preventions are essential. Addressing hypertension is crucial to reduce healthcare costs and improve public health outcomes. Especially in our Black and Hispanic communities, we tend to see it a lot more. So and those two communities would be a lot more help if we could prevent it a little bit earlier than waiting so late to try to treat it. Some treatment options for us, our standard medical treatment includes common medications like ACE inhibitors like lisoprone, beta blockers like atenolol, and diuretics, which is like hydrochlorothiazide. And these often are used as like first line defense for our patients who we diagnose with this. So these prescribed pretty often. And these medications help reduce the volume of blood or relax blood vessels, thereby reducing the blood pressure in that way. Another way people can kind of treat this would be lifestyle modifications, and that's just like changes in diets, which is a program DASH diet that helps with this. There's regular physical activity, weight loss, and reducing alcohol intakes. Um, yeah, so if you have like a mild case of hypertension, it's possible to just reduce it just based off lifestyle changes, and we see that a lot in people. These lifestyle changes focus on reducing the factors contributing to high blood pressure, such as obesity, poor diet, and lack of physical activity. So that's another treatment would be self-monitoring blood pressure, which we'll call SMBP. The SMBP intervention allows patients to monitor their own blood at home using a monitor that shares the results over with the healthcare providers. This could be essential in catching things early because rather than waiting to go to the doctor to get tested, we kind of can see it at home, and the healthcare providers can see it before and kind of start getting treatment for it. SMBP includes education on lifestyle changes and encourages patients' engagements in their own care, being that they can see it and they kind of firsthand have that. The research has shown that SMBP significantly improves blood pressure control and increases patients' engagement in managing their own condition. Like we said, being able to do it at home, they can kind of see themselves getting worse or better as time go on. The limitations to this would be have not all patients have access at home. They might be doing the wrong errors, or even that it may increase anxiety. It may increase anxiety in some patients who over monitor their symptoms. Our treatment options, when we look at it, standard care would be around 1,800 annually per patient, and the benefits is only 0.6. Um, and the cost for that would be 3,000. Now at home would be 500 annually, and the benefits would be 0.7, and the cost would be $667 per QL. So our chart, we see that it is more effective to use the SMBP. In this case, when it comes to effectiveness, the cost and the CE ratio, which is cost per quality. So for us, the most effective treatment would be SMBP. It offers a higher quality for significantly low cost, $500 compared to the standard treatments, which is $1,800 per zero with 0.6 quality. This means SMBP provides greater healthcare benefits per dollar spent, making it more cost effective than the standard treatment would be. So SMBP is more cost effective option that it not only improves health outcomes but also encourage patients self management, leading to better adherence and long term control over hypertension.